All right, the Ontario Clinical Exam is an exam that PT residents are eligible to take after they've successfully completed their written exam. So this exam is a 3-hour exam and it is composed of 2 parts. So during this exam, you're gonna have to explain your clinical reasoning, verbally explain your clinical reasoning, and it's virtual. So you'll go on your computer and from there, you're gonna be meeting with panelists on the other side of the computer. Now in that part 1 and part 2, it's further broken down. So in part 1, you'll have to review 2 cases. Case 1 mostly deals with assessment and case 2 mostly deals with treatment. In case 1, you'll have 4 aspects that you're gonna have to go through. So the first aspect is accepting the patient, then you'll have informed consent, your clinical exam, and then you have to explain your clinical reasoning and recommendations. Right, so also in part 1, you will have to go through case 2. Now case 2 has 5 areas that you're gonna have to go through. And those areas are developing a treatment plan, developing goals and patient collaboration, consultation, and referral to others, monitoring, reassessing, modifying the plan, and/or promoting self-management. And the last one is discharge planning or transitioning of care. Now, all of these topics can be found on the exam blueprint on the College of Physiotherapists of Ontario's website. So if you want to look at those again, you can see them there. All right, at the start of the case, you'll be given a core question. Now, this core question might be something like, describe the steps you would take to conduct an assessment. Now, you can either read the question yourself or you can ask the examiner to read it to you. You will then have 5 minutes to think through and formulate a response to this question. When those 5 minutes are up, the examiner is going to tell you that it's time to give your response. If you need a few more minutes, you can take them, but keep in mind you need to get through all this information in the exam, so the examiner might push you along a little bit if you're taking longer than you should to prepare. Now, all candidates will receive the same standardized core question, okay? So each case will have anywhere from kind of 2 to 3 to 4 to 5 core questions. We're not totally sure how many core questions people are getting, but we're seeing that range. So the examiner will provide you with additional information, potentially when asking you this core question. So that additional information could be something like tests, maybe additional information about their condition, potentially some outcome measures that they have the results to, and then they may ask you to give your answer. Now remember, every time a core question is asked, you will get an additional 5 minutes to prepare or formulate your answer to that question. Depending on how thorough your response is to that core question, you may be asked a probing question. Now, not all candidates will receive a probing question. Probing questions are used by the examiner to elicit more information from you. So if you've given a very thorough response where you've covered everything, you won't be asked one. Don't worry if you are asked one though. They're not going to take away marks for asking a probing question. They are there to help you. Here are some examples of probing questions. Explain how you would get consent for the assessment. What is the most important objective information that you should collect? Why is this information important? How would you determine the patient's level of pain or discomfort? What effect does the patient's pain level or discomfort have on your assessment? The CPO has released an example of case 1, so part 1, case 1. Now, if you've gone through this and you feel a little bit intimidated, don't worry. It is a little bit stressful at first glance. But one of the perks of taking our course is that we do give you a step-by-step approach so you know exactly what you need to cover in each of the areas to make sure you answer this question thoroughly. But let's show you the question. Take a read through this if you want, but remember, you can find a detailed answer key for this question in PT Exam Prep's OCE course. In part 2, you'll be given 11 vignette-style cases. Now, these cases are going to cover professional standards and ethical principles. Now, the College of Physical Therapists of Ontario has released another example for this. So let's take a look at it now. In part 2, your examiner may ask you probing questions if you're having issues answering any of those 11 vignette cases. Those questions might be something like, how would you proceed in this situation? Explain why you would take this action. Tell me about the conversation you would have with the gym owner.
You can also find this answer key in our Part 2 classroom. Here's a little sneak peek into the classroom. As you can see, each of the professional standards are broken down, and we go very in-depth, giving you a lot of information so you understand. You scroll down in the classroom, you'll see over 170 practice questions. Each question comes with a scenario followed by a very detailed answer key. So whether you're preparing for Part 1 with the cases or Part 2 with the vignette style questions, you will be well looked after.
Hopefully this helped, and we'll see you over in our OCE course.